Okay, so this is fraud warning number 1. As you may know, insurance companies are recouping more and more money every single year from doctors of chiropractic. The main reason is that they do not have strong treatment notes, and they don't have it weighted or justified with a strong treatment plan. You got to understand that a treatment plan is not a one-sentence statement like we learned, or some of us learned in school. It is an actual rationale for why you're doing all of the care that you're giving. So if you have 4 diagnoses, it would include the plan for each diagnosis. It wouldn't just be an overall idea. It has to be very specific on the goal and the specific points that you're trying to achieve with that patient. And it has to state those things succinctly. And then your notes need to make sure, your SOAP notes, they have to line up with that treatment plan. So you know the diagnosis has to line up with the treatment plan, your SOAP notes have to line up with the treatment plan, and your treatment rationale have to line up with the treatment plan. That means that your treatment should not stay the same for 20 visits. There should be changes in the treatment plan. You should see a change from passive care to more active care. You should see a weaning off of those passive modalities, moving more into active care. You might even see a weaning off of the number of visits. It might go from 5 times a week the first week to 3 times a week the next week, and maybe even to the next week, and maybe even to the next week. As long as you're doing active rehab, you might be justified for doing 3 times a week. But at some point, you're going to have to wean that patient off of care and show the insurance company what the supportive rationale is. So make sure that you do everything you possibly can to understand how to properly document, how to have treatment plan rationale, so that when you ask for your files, because they are on the rise, insurance companies' request of files for review is on the rise for a specific reason. They know that your notes aren't where they need to be, and that if they review the files, they'll be able to ask for money back and get to keep it. I would like you to be able to keep the money that you work hard for, so the way to do that is to understand how to keep active treatment plans and treatment notes that correlate and make sense to the insurance companies, not just to us.